Welcome to Midlife Moves, where we're figuring out this whole midlife thing one day, one workout, and one what the hell just happened moment at a time. I'm Heather, and if you're navigating career shifts, fitness goals, parenting teenagers, or just wondering when the hell we became the grown-ups, you're in the right place. Let's talk about the real stuff, no filters, just honest conversations and a little bit of chaos. Let's get into it. Hi, I'm Heather Francis, and welcome to another episode of Midlife Moves. First, a couple housekeeping notes. It is midsummer. It is June 29th in my house, and there are children home, and there are dogs everywhere, and there is noise happening in my house. And so you're probably going to hear the dishes being done in the background. But do you want to know what? That's okay, because that means I'm not doing them. So we'll deal with that noise right now. On a more serious note, who amongst us does not have a story about going to the doctor and telling them what was wrong, expressing concerns, going through a list of things we would like to address, and leaving feeling less than acknowledged, feeling like we were not heard, or what they heard was not what we were saying? We left feeling gaslit, for lack of a better term. I think that any of us have a story like that. I can think of 5 right off the top of my head of just expressing concerns or expressing things to different providers, whether it's my PCP or a specialist, and leaving there feeling like they just didn't get it. They didn't get what I was trying to say. Today, I talked to Nikki Sapiro Vinckier, and we talk specifically about that. Nikki just wrote a book recently called We Deserve More, and she talks specifically about medical gaslighting, what it is, examples of it, how to advocate for yourself. And the conversation that I had with her was really enlightening. 1, I got a lot of information out of it, but 2, it made me feel like, I did have these experiences, and not just I have those experiences, but like most other women have those experiences. And do you know what? A lot of us have them with women physicians too, which I guess is wild and also makes sense at the same time, right? I would give you more stories, but I think I tell a lot of my stories in my conversation with her, so I'm not going to drag this introduction out and make you listen to me whine about the things that I don't like about my doctors more than you absolutely need to. Without further ado, here's Nikki. Here's my conversation with Nikki. As always, if you have any questions, if you'd like to get in touch with her, with me, have any, anything, guys, let me know. Let's get into it. I am joined today by author of We Deserve More, advocate, OBGYN PA, Nikki Sapiro Vinckier. Thank you so much for joining me.
Thank you for having me. I'm so happy to be here.
This is gonna be so much fun. When I first heard of you, I got an email from you, and it was the email subject line was medical gaslighting, and I was like, oh, I want to read this one. This is going to be good. So first, before we get into it, can you tell everybody a little bit about yourself?
Yeah. So it's great to meet all of you. I'm Nikki. I'm a mom of 3. My kiddos are young, so they're 8, 6, and 4. And I've got a dog and a cat, so it's a crazy busy house that I live in. And I've been an OBGYN for the last 10 years. And it was really in watching what some of my patients were experiencing and then getting texts from friends over the years being like, hey, this happened in my visit. What do you think about it? Right? These kind of like, we call them curbside consults in medicine. So these like side texts being like, hey, what do you think? And then it was really in noticing what their experiences were like and in seeing my own experiences and having kids through the healthcare system that we're in now that I was like, I don't think this is really serving us too well. So that was kind of where my advocacy journey had started. And then when Roe versus Wade fell, I was, in OBGYN already. So I started doing kind of reproductive healthcare advocacy, not necessarily because I wanted to, but because it kind of became synonymous that if you wanted women to have, good access to healthcare, you had to start caring about it outside of clinic too.
What did you call it? A curbside consult?
That's right.
You probably get them all the time.
It's really great. Honestly, it's like, I do them to people also too, because I'm like, I know this will only take you 30 seconds to respond. And then it gives me that like instant peace of mind.
Yeah.
So like,
right.
I'll do it to pediatricians, about my kids. Like we like trade it back and forth. I'll send them something about an upper respiratory infection and they send me something about a yeast infection. It's fantastic.
It's just the service trade service, right? Or, yeah.
Exactly.
Yeah. So Nikki and I were talking about the Maycember time of year that we're in right now and how nuts it is with family. And she has her book that is just being released this month. Is it released already or is it being released? It just was released.
It just came out last week.
Last week. Let's talk about gaslighting in general. So this is a term that we hear all the time. Can we just start at the very beginning? And what is medical gaslighting?
Yeah, the way I explain it often is, whether it's medical or not, when somebody tries to downplay the way that you're feeling and make you feel as if what your emotions are feeling and how you're experiencing an interaction to be, as if it's something completely different. So medical gaslighting, how I often explain it, is when you're talking about being in pain and someone downplays that pain. Or if you're talking about something that's of concern to you that impacts your quality of life and it's being negated or kind of tossed aside as not very important, almost in an effort to make you feel like it's not important. And so with medical gaslighting, it's really kind of this concept and framework of not getting the right support from the clinician that you need in that moment.
I think that a lot of women have experience with this, and they probably leave the office sometimes thinking like, I don't even know what happened, but I know that this appointment did not serve me. I know my own experience with it. For example, I had a UTI. I knew that I had a UTI because we're women and we know what they are, right? We know how that feels. And it was to the point that I was peeing blood. It was bad. Sorry, girls, TMI.
There's no such thing as TMI. We're scrapping TMI.
I gave up any sense of modesty once I started doing the show.
It's gone.
So I was peeing blood and I went to the doctor and I was like, I need an antibiotic for this. I know what this is. And he was like, are you sure you don't have your period? And I was like,
oh, man.
Yes, sir, I'm sure.
One of my favorite trends that I'm seeing online are all of these like it's on Threads, all these like medical x-rays or whatever, where it's like something that's obviously really bad. And someone responds being like, are you sure you're not just on your period? Or when was your last menstrual period? Or like, we should take a pregnancy test. And it's like an actual fracture that's like so visible. And okay, so this is exactly the point, right? This is exactly the point. This idea that people aren't actually listening to us, that they don't actually kind of hear our concerns, and that they're very quick to just like pick up and pivot. But like, I think about it all the time that if men were to come in with the exact same complaints, how much more would they be listened to? And I think that plays a big piece into medical gaslighting as well.
So how do you know? So if you go in and you have a complaint, like my example is pretty extreme. Like if you're peeing blood, like there's something wrong. But if you go in, you're like, this weird thing is happening to my body and I know it's not right, but I know like, it's not like super serious. And somebody's like blowing it off. How do you, one, recognize what's happening? And two, how do you advocate for yourself beyond that?
Yeah, those are great questions. And I think what's most important to address too is that medical gaslighting isn't always from a malignant nature. Like sometimes there's the doctors and clinicians that are like overtly, right, terrible. But then there's also just clinicians that are trying to get to the bottom line. And we're not always great at describing our symptoms, or they're rushed, they're running behind, you've got 5 minutes, like you just don't get to the bottom of it quick enough. So I'm quick to also share that I think that there's a lot of pieces that play into this. What I think is most important, kind of Heather, exactly what you said, is knowing your own body to know when things are wrong. So like exactly what you said of, I know this is a UTI because I know my body. That is the best thing we can do before we go in. And once I had a patient who we were done with her visit and she's like, okay, what other questions should I be asking? And I kind of like chuckled to myself because I was like, I'll sit here with you forever because I care a lot. But most clinicians are like, oh, no further questions. Great. And they walk out the door because we don't have time in our healthcare system. And so it was in that moment where I really realized that as patients, we really need to do homework before we go into our visit. We really need to like sit in detail exactly what brings us in for that visit. Because when we come in with more receipts, when we come in with a better detailed summary of exactly what's going on, how long it's been going on, have we tried anything to make it better? Does it respond to ibuprofen or Advil? Does it get worse cyclically? Does it get worse with any food consumption, right? The more you've like really sat down and triaged yourself first, the more we're going to be able to get out of the system what we actually need rather than them kind of like tiptoeing around a possibility.
That's an excellent point because I know myself, and I think that a lot of women probably do this. We downplay the things that are going on, right? Because it's like, oh, well, it's not that big a deal. So if we're not making a big deal out of it, if our physician is saying that like, oh, well, they're clearly not concerned if they're just kind of like, oh, I've got this, like I'm just peeing blood, like if we're downplaying it, they're not going to know the severity of it. They're not going to know how worried about it we actually are.
Yeah, and I think that falls into so many different reasons. Number one, women are kind of like taught to just like show up and be the good patient, be the good girl, right? Be appreciative for the care that you're getting. Don't cause too many problems. Don't cause too much stirs. Like we see this all the time. Women will go get a manicure, and if they hate the color or the shape, they don't correct the nail technician. We won't tell the hairstylist that we hate our haircut. And so like if we're not happy at the nail technician and we're not happy with our haircut, we're definitely not going to say anything to the doctor who's providing our care when there's a big power imbalance between that. So I think about that all the time, that as women, we're conditioned to just like swallow our pride and swallow the things that we're thinking rather than actually bringing that up in the moment to say, this isn't serving me.
Can you think of a time that you've experienced something like this?
Oh, man. Well, when it first became obvious to me was when I was postpartum with my first kid, and I had very severe postpartum anxiety and depression, and was like just number one, they never even did any screening to see if I had postpartum anxiety and depression. And I later learned it's because it wasn't reimbursable at the time. Which is wild in and of itself. So like talk about like there's like overt gaslighting, and then there's also just like the challenge of the system of like not recognizing us and seeing us and meeting us where we are. And so I think that that's just a different level also of not getting the care and access to care that we need. But that was the biggest one for me, was kind of the like missed postpartum anxiety and depression when every single clinical sign was there.
Especially postpartum, right? And I guess really so much of what our doctors our doctors are so beholden to the insurance companies.
That's right.
And that's not their fault, and that's not our fault. It's just like an unfortunate consequence of our system. Mm-hmm. Right. And that's, like, I don't even know what the answer is to that. That sucks. That sucks.
Mm-hmm. Yeah, it does. I think about this from so many different parts of our care, is that, for example, procedures are reimbursed much higher than just conversations. So it behooves our clinicians to do procedures over sitting down and actually talking to us. And so what does that also mean, right? And how are we incentivizing clinicians to actually sit down and have those longer conversations with patients that we need? And I think that we just kind of like are in this rat race where we can't ever even get the time that we want. And that time's not reimbursed. And so it's like you're just up against a wall all the time when it comes to reproductive health care.
You go for a visit. You know that something is wrong, and you know that you're not getting the care that you need. At what point do you say, I just need to see a different doctor? Like, how do you differentiate between?
Yeah, great question. And I think, it's the reason why a lot of us stay in relationships longer than we need to. Right?
Yeah.
I mean, I think that's a bigger commentary is it's a pain in the ass to switch, right? It's annoying to switch. It's annoying to like move your records and transfer paperwork and like start and see somebody new. And like being totally realistic, it takes a long time to get in to see someone new. So like it is a pain in the ass. And I think that that's what deters a lot of people from doing it is this idea of like, oh, it's not going to be worth it, right? And so there's a lot of answers to that. I think in our heart's heart, we know if it's the right fit or not. And I think it's really just listening to that. And it's really not that much of a pain in the ass, right? Like you fill out a little bit of paperwork, you bring your records with you, or you have them sent digitally, and like you sit down and again, do the homework to be like, what are the pertinent things in my health history that my next clinician needs to know about me? And then really, I think like taking that time to really almost like take a self-reflection to be like, what is my pertinent medical history? What are the pieces that matter to me physically, medically, emotionally, hormonally, all of those things. So it's almost like when you do go and see a new clinician, you get to paint the picture of like, what's really bothering you now? And I think that's almost actually kind of like a liberating thing. It's like you get this little opportunity to reinvent yourself of like, well, what are the pieces that are important to me now? Not the fact that I had 3 kids 15 years ago, but how am I feeling in this moment in my body?
Yeah, like what a good point, because so like it, for example, you see somebody and how much I have like 18 things that I want to say right now. First of all, how much does our gut tell us? And we know the answer already and we just don't listen. And that's like in this situation, that's in like everything in life. Like we know, like we feel it. It's just a matter of listening to it.
Yeah, it's a matter of listening to it, and it's a matter of like following through, right? It's a matter of like having the guts to actually be like, I hear you in my heart and soul, and I'm going to do something about it.
When
like it seems so simple, doesn't it? When you say it that way, you're like, of course. Yeah.
Of course.
Right. Yeah. It's such a duh, but it's like not, I don't know. As women, like we just don't do it. But we would tell our best friend, like, it's time to find a new clinician. Like we're 100%. So defensive of our best friends, but then we don't hold that same standard for ourselves.
100%. And that's actually a really good benchmark. Like that's a really good test to put yourself through. Like if my girlfriend told me this story, what would I tell her?
That's right.
You know, like this is what I would expect her to do.
Yeah.
Yeah. And we don't do that for ourselves. We don't give ourselves the same grace.
Mm-mm. We
have 2 main health systems in my area. And so like when you go to switch physicians, it's like, okay, am I going to be with this health system or am I going to be with this health system? And so like making those changes is like, it feels overwhelming because it's like, oh, well, all my other doctors are in this health system. So do I leave? It's just excuses. It's excuses. That's what it is.
Yeah. And, you know, it's excuses, but it's also like the healthcare system is set up intentionally, almost, it feels like, to be so like a jigsaw puzzle. Like the fact that you can't just have a universal record where anyone could see those labs, like that would make it so much easier to be able to switch. But it is right now in our system. It makes a lot more sense if you're set up within one hospital system to stay there because all your records are there. That being said, if you wanted to switch, there's nothing that says that you couldn't transfer all of that information. But again, I think a lot of the onus is going to sit on you to really go through it and say, well, what are the things that are still pertinent? And how do I make sure that that gets across? So going back to self-advocacy, I have been told by my doctors to stay off of Google. So I have health anxiety. I'm aware of how that comes off, but if we know that we have something wrong with us and there is a test that we feel would be important in coming to that conclusion, is it fair for us to ask for that test? 100%. 100%. So this is actually, I think, the most important thing. And, you know, you say, I was told to stay off Google. Right now, what everybody's doing is they're chat GPTing or AIing their symptoms. Yeah. And so they haven't just like been told, here's the test that you need. They're being told, here is your diagnosis, right? And then with ChatGPT, what we know is like, it does it with full confidence. Full confidence. You are guaranteed that that's the right answer.
Yeah.
But we see across the board that it's wrong in diagnosis like 45 to 60% of the time, and a lot more frequency of them being wrong is with women, because it's looking at all these studies where women weren't actually in the studies. So they're looking at and pulling data from studies of men, which is insane to begin with. So what happens is that women will come in with this, like, I know this is what's going on because this is what ChatGPT told me. And the way that I tell people to use the internet to help them is not to figure out, well, what is it that I have in terms of diagnosis? But actually, I think, Heather, what you're doing is perfect. Like, what are the questions I need to be asking my clinician? What are the tests that would help me decide, right? And then figuring that piece out, and then using that as a tool to enrich and improve the interactions you have with a clinician. So you're still relying on a clinician, their credibility, their kind of understanding, and their physical examination of you. But you're also bringing in, like, here's how I feel, right? And here's, if you're searching and Googling something, there is a reason why you Googled that thing. And often that reason is not being parlayed in clinic. And so often when I would have patients that would tell me this is what I was searching, I'd be like, well, why were you searching that? Like, tell me more about the steps in your process so we can learn more about how are you feeling? What are the moments that brought you there? Was it a breaking point at 2 a.m. when your pain was so severe that you were doubled over by the toilet, right? Like, tell me more about the moments so that we can figure it out together. And so I think in terms of using the internet to augment, that's exactly what I would do. I would use the internet to augment your health experience. I wouldn't use it to replace. And, you know, in terms of like why doctors tell you don't Google things, it's because in a way they think that it's going to cause you more anxiety to Google. And I think you need to know yourself to know, is my Googling habit making my anxiety worse? Or is it actually improving it? Because for many people, having access to the internet is actually a really helpful tool in being like, oh, I'm understanding what's happening to me more. Or, oh, I'm learning that I'm not the only person in the world who feels this way. I'm part of a community of other people. Like, there are all these amazing examples of internet communities. For example, there's one called Nancy's Nook that's on Facebook. That's an endometriosis group where it's people who talk about their endometriosis and get recommendations for different surgeons online and endorse it and whatever, right? And like, the reason why that internet searching and internet experience matters is because that might be the first time that someone with endometriosis feels seen, heard, and like they're not alone. And I think that's invaluable. Invaluable. So like, it's easy to paint like, oh, going to the internet when you have a medical question as a bad thing. But I think it can also be like hugely informative, hugely supportive, hugely validating for people that aren't getting that in the clinic.
I think that that's a really good point, especially like, so women, I'm 45. So I'm in the thick of perimenopause. The experience that I know a lot of us have had has been like in the years leading up to this, us going in and maybe asking questions like, I have this symptom and this symptom and this symptom, and maybe being told, you're too young. You're too young to be thinking about menopause. You've got another 10 years before you have to think about that. And now all we see is perimenopause and the ages that it affects. And so, you know, and my doctors now have done a very good job with keeping up with that. And, you know, like their tune has changed over the years. But a lot of us are still, I have to imagine, experiencing that disconnect because perimenopause, like, it's hormones. Our hormones aren't tested automatically.
No, it's like reverse puberty is how I explain it to people. As in, like, puberty wasn't just the first day that you got your period. The same thing with menopause. It's not just like the last day you get your period and it's over, right? Puberty was a multi-years development where you were getting boobs. You started to get BO. You figured out, do I need to shave my legs? Like, all that weird stuff that was happening slowly over time. On the other side, with menopause, we're also seeing maybe you got moodier, right? Like, all those same things happen on the flip side as well. And I think for so long we weren't talking about it. And there were, you know, lots of different things that didn't help this. But I think now finally our generations are saying, this is enough. I've had it. I'm uncomfortable. I'm unhappy. I feel more anxiety. I've had more weight gain, whatever the XYZ factors are that you're experiencing. And finally, I think we're making enough. We're stirring enough like chaos that they're like, well, we have to respond to this and we have to figure out how to improve their quality of life.
Yeah, because I know my doctor, when I went to him first a couple years ago, he was like, you're too young. And then when I was there more recently, he was like, I think we need to talk about HRT. And I was like, all right, good.
Yes.
This is what we want.
Yeah. And I think, I mean, I am a firm believer that the way we change the medical care we get happens in conversations like this, that we have to change cultural expectations and cultural norms in order to apply pressure onto the medical system to respond to those needs. And we saw it happen with IUD insertions, for example. So many people were having these miserably painful IUD insertions and there was no pain management offered. And then enough young women live streamed their IUD insertions in their gynecology office.
Did they really?
Oh my God. And got millions of views. And all of these women across the internet saying, this is barbaric. Where is my pain management? Men would never go through this, right? And then just last year in 2025, ACOG, which is the American College of Obstetrics and Gynecology, finally came out with pain management guidelines for IUD insertions and endometrial biopsies just last year.
I had an ablation. An ablation as part of a larger procedure. So I was not awake for it. But when they told me that they initially were planning on doing it while I was awake, I was like, the fuck you will. Nope. I will not get it done then.
Nope. Yeah,
I will not get that done.
Absolutely not. And like, it's across the whole spectrum. Like I had 3 babies. I had 3 epidurals that were not fully covered by insurance. And then my husband goes to get a vasectomy and he gets put under like late, anesthesia because he gets woozy and whatever, which is great. He should have good quality of care. And that gets fully covered by insurance.
Yeah.
And I'm like, are you fucking kidding me?
You're fucking kidding me.
I birthed 3 children and my anesthesia for my epidural was not fully covered, but your twilight anesthesia for your stupid little snip is fully covered. Like,
It's infuriating. It's
infuriating.
We joke every time I get a mammogram, I come home and I'm like, if you guys had to have these done, this would not be this mortifying. We would not, no. It wouldn't be this situation.
No. Yeah, I know. It is. Yeah.
Let's talk about your advocacy work now.
Fun.
You do some advocacy work, specifically centered around reproductive rights. Can you talk a little bit about that?
Yeah. So I do a lot of content online, which is really fun because I get to just like that same piece of the puzzle.
It is good. It's very good.
Thank you.
Yeah, I enjoy it.
Thank you. But that same piece of the puzzle of like, I think that the conversations that we have are what pushes and changes healthcare. Like that's really what I aim to do is kind of like change the way women feel like they can talk about their healthcare. And it's the same reason why I said to you earlier in this conversation, there is no TMI because we've been forced to think that like, it's not okay to talk about peeing blood when like, that is an experience that more women have had that listen to this podcast than we will ever know. Right. And so I think that if we actually like take those shackles off of ourselves and not be burdened by like the TMI piece of the puzzle, like how much better off are we actually? And so I think that part's really cool. But recently I was part of a lawsuit where we sued the state of Michigan, which was really cool. So if you remember the case of Adriana Smith, who was in Georgia, she was declared brain dead while 9 weeks pregnant and was forced to remain on life support so she could incubate the child. I learned after that case that same thing could still happen in Michigan and a few other states. And we had passed what we called Prop 3, which was we were the first state to enshrine reproductive rights into our state constitution. So there was a group of plaintiffs and we sued the state and said that this is unconstitutional. And so what it had been was there was this pregnancy exclusion, which meant that if you were pregnant and you were brain dead or dead, all of your wishes were immediately null and void. The second you become pregnant, the second you have any detectable HCG hormone in your body, everything you want is null and void. And so that didn't sit well with us, obviously. And no. And we sued the state and we won. And it was just this like very cool moment to be like, okay, Prop 3 was a citizen-led ballot initiative, which means that a bunch of us, you know, had gotten together and said, this needs to happen in our state constitution. A bunch of us gathered signatures to get it on the ballot. And then obviously, you know, a large majority of the states showed up to vote for it. We enshrine it into our state constitution, and then we use that new state constitution to go after these bullshit antiquated laws and say that's unconstitutional. So when I think about kind of the whole progress and pattern, it's so inspiring to me personally, because I'm like, oh, we fucking did every piece of that.
Yeah.
That wasn't legislature. That wasn't an elected. That was entirely citizen-led, citizen-challenged, citizen overturned. And like, that's really cool. That's really cool when that happens.
You must feel immense pride for having such a part in that. Like, you affected change. And that's not that's hard.
Yeah, that part's fun. And there's a lot of amazing orgs that do that stuff. Like they took actually like the bulk of the work. So there's an org called If When How and Compassion and Choices. And they're the ones that are like looking around the country for these things that they can overturn. And so what happened is I'm like pretty invested in some of these groups. And one reached out to me being like, hey, I think we're going to do this in Michigan. Would you want to be a part of it? And I was like, hell yes. And also I have DMs from 5 other women who want to be in it. And what had happened is when this case had surfaced, all these women were sending me DMs. And so I had screenshotted them and sent them to myself, knowing when the time comes, I've already got an army. Yeah. And so like, that's a cool thing too, is the power of community. Like so quickly we were able to assemble the right plaintiffs to get this case kind of to happen. And so it is this like, we see the other side do it often when we call it like cherry picking judges and cherry picking court cases and all these things. I'm like, fuck it, 2 can play that game, you know, like we can do it too.
Yeah. How long did it take from beginning to end? What was that process?
Oh my God, it wasn't even that bad. I want to say it was like 8 months. It was really not that bad.
Is that all?
Yeah, it was
I thought
really
you were gonna
not
say
bad.
It was like years.
No, it was quick. And actually my favorite piece of it that is really cool is they were looking for some other plaintiffs. And I asked my husband, would you be open to hearing about the court case? And so I set him up with the attorneys who were helping us to do this. And he was a plaintiff in the case as well, saying that it was his rights that got infringed upon because he would be my power of attorney to make those decisions. Yeah. And that's so freaking cool because like very cool. Not that many people care about a woman's rights, but a man's rights that get infringed upon.
That was really smart.
It was really smart. And also like, it's cool to be on that case with my husband as well. And it's cool to be like, oh, men can do these things. Like men should be doing these things. It is not just a conversation for women to be having only. This is a conversation where we need men on our side in order to get shit done better.
I give men a really hard time. Like I
Same.
A lot. But my husband would do something like that. And I think that needs to be celebrated too. Like
yes.
Good guys.
I know. It is cool.
It's very cool. So I'm not going to take up too much more of your time. So I'm going to ask just one final question. If you could have my listeners walk away with one thing from this, what would it be?
I think the takeaway of the things that we kind of circled throughout is the planning before your healthcare visit. Is the like taking 5 minutes the night before you go in or the morning of and just saying, what are my actual interests when I leave the exam room today? Right? And really figuring out, are there things that you want accomplished or achieved in that visit and what are they? And what are the things you need to share in order to get to that place? And I think if we all went in with more intention into our visits as well, I think we would get more out of it that way.
I'm so glad you were on my show today.
This was so fun.
This was a lot of fun. I'm glad we did this. If people want to follow you, what is the best way for them to do that?
Yeah, they can follow me at Nikki Vink, NIKKIVINCK. And then my book, it's called We Deserve More, and it talks all about these things. And I actually wrote a workbook as well. And the workbook is specifically focused on skills development for some of these things we were talking about.
And I'll have all of that listed in the show notes.
Yay.
So you guys can find her easily. Nikki, thank you so much. This was wonderful.
Thank you for having me. Have a great day, everyone.
Yeah, bye, guys. Until next time. That's it for this episode. If you had fun, learned something, or just feel a little less alone in the chaos, make sure to hit subscribe so you don't miss what's next. And if you want to keep the conversation going, come find me on Instagram at HeatherMoves_, because midlife is way more fun when we do it together. Until next time, keep moving forward, or at least keep moving. See ya.